So this is another one, and this is a young dude, and he is on the hunt for a girlfriend, and he thinks that his smile looks a little timid. He's not happy, and he already knows he doesn't like it, and he comes to me and he wants me to tell him what can be done about this. So I need to see a few more things, hopefully, than he does, and there are a few more things, like his gum line is asymmetric, tiltedness of this tooth, he has worn his teeth a little bit, and evidently the spaces. So we need to utilize the space that we have and create veneers. Now, having talked about preparation design of teeth for veneers, it is important to know if I want to close this space here and I want to have a nice emergence profile of the porcelain coming out of here, I have to prepare the tooth under the gum line to come up like this. I have to prepare the tooth down under the gum line to squeeze up the gums and come like this. If I don't, I would create a balcony here. So this is one of those elements that need to be known about patients with spaces. We will have to insert the veneer somewhere here and go around. And also here, to create a little bit more translucency, we will have to reduce the incisal edge to a certain degree. And this is evident. I will have to reduce. This is a good example that I have to reduce here. I don't have to reduce anything here because I want to add length to this tooth. So I'm conservative in this area, but I have to reduce in this area to actually be able to place the veneer later on. Also, what is very evident is that this tooth, canine, is round, while this tooth is flattened. So he has some wear habits more on the left side. Another thing that's evident is that those canines are yellower than the incisors, which is natural. And this is what we want to design when we create porcelain veneers on our patients. We don't want all teeth look the same color. We want the canines look a little bit more warm, a little bit more orange than those 4 incisors. And this is how he looks afterwards. So we close the space, and we have a nice emergence profile here. It looks like the tooth is growing out of the gums, just like that. And you can see how the gums have been squeezed up just by inflating, quote unquote, the porcelain in this area and in this area, which is very important. If you close the spaces, you want healthy looking gums squeezed up all the way up here. It's almost like a water balloon. And you can establish this with proper techniques, of course, not too traumatic. You have to know the right amount of pressure, and you test it with your long-term provisionals, which most of my patients have if they're not in a rush. And we see again that we have a halo effect. Here's a guy. He didn't want too much translucency in this area, but we have proper contours. We have the proper line angles, opening up of the embrasures. Here the embrasures, those triangles, they're called embrasures, are further open than here, here, and here. So they open up progressively as you go to the back. This girl came to the office asking me whether she would benefit from orthodontic treatment. And even though orthodontic treatment can close spaces like this, it cannot address the discrepancy between small teeth and large dental arches. So even though we can close the spaces with brackets or Invisalign, the smile will still look timid if we just push those teeth together. In addition, orthodontic treatment would not handle something like a reversal of line angles, like this line angle here looks more rounded than this one, which is sharper, as opposed to this one is really sharp, and here it's more rounded. It should be symmetric. This one should be sharp, and this one should be more rounded, while closing, of course, the space. Then we have suddenly a lateral incisor that is rounded off like this, and here we have a straight line like this. All this would not be handled with orthodontics. Yeah, probably a misalignment has caused the tooth to sit on the lip here while it's hidden here. So certain misalignments are responsible for the appearance of certain line angles and shapes. But overall, orthodontic treatment is not able to create proper proportions between teeth that are naturally smaller. This is her afterwards. And everything that I just talked about has been addressed. She has a much more vigorous smile. She couldn't afford to work on her back teeth. We did some gum lifts on both sides, but if I had a choice, I would have added a veneer or built up the teeth a little bit more here and here. But just staying in this segment, it's much more vital. We have proper golden proportions, 1.6 to 1 to 0.6 on both sides. And we again have mamelons here and here, the halo effect, and again, the opening up of the triangles, attributing to a more youthful smile. The size of the teeth also create a better harmony with the fullness of her lips, taking away of the timidness of the smile that she had before because of a miss or unbalance between full lips, large jaw arches, and small teeth. Now everything is in a proper harmony.